Okay, I currently have with me Michael Mui from Dr. Shu Ping Rong's office. Michael is actually the husband of Dr. Shu Ping, and he handles, I think, the marketing side of the company.
Yep.
And thank you for being on this. The reason I'm doing this is actually to go out to our community and talk to local businesses. And basically, I want the customers to come to use your business because a lot of people from the pandemic are just staying home and they're just watching TV. So I want to put this on like YouTube and Facebook. Do you have any questions before I get started?
No.
No? Okay. So, Mike, I'm going to start from the beginning. Where are you basically from? Are you from China? Are you born here?
I was born in Taishan, China, the south.
Okay. And then when did you come over here?
1979.
Okay. And so how long have you and your wife basically had your...
Since 2011.
Wow, that's almost 10 years already.
Yep.
Wow. Okay. Why'd you guys start the dental...
She enjoys the surgeries. She enjoys the surgery. She's very good at doing like gum surgeries and implant surgery. That's what she enjoys doing.
Okay. So about your office is a cosmetic dentistry. What services that you guys particularly offer?
We do all kind of surgeries. We do from dental implants to bone grafting to sinus lift to gum surgery. A lot of people in the community have a lot of gum.
Really?
That's a big reality in the neighborhood area. Not just Chinatown, but the whole surrounding area. So it's a lot of gum disease. They don't even know it. So sometimes when they get a cleaning, they go, "Oh, my gums are bleeding. It's caused by the hygienist." No, it's because you have gum disease. That's why the gums are bleeding.
Tell me more about it.
So, the patient comes in, they get an exam, they get the full mouth X-rays, and then they, Dr. Wang would explain to them what exactly is going on and what are the options for treatment. Okay. So if somebody has gum disease, they cannot get an implant. They cannot get braces done. So we do a lot of braces. We do a lot of implants. We do a lot of different kind of surgeries. So, but if you have gum disease, if you don't take care of the underlying gum disease problem, you cannot get any of the above done.
Wow. Okay, that I did not know. And how long does it usually take to treat actually the gum disease?
They could have the gum surgery done. The gum surgery could be, if it's full mouth, both the left side, upper, lower, and then the right side, upper and lower. That could be anywhere from 1 to 2 visits. So they could do one side, the whole entire left side, upper and lower, gum disease done. Treatment, and then they can do the right side the next visit. Or sometimes some people choose to do the whole entire, because we have patients that come out of state, from Pennsylvania, Philadelphia, North Carolina, Connecticut. So they when they plan around the trip, they come in, they get the whole surgery done one day.
Wow.
And then after that, after you take care of the gum surgery, then you come back for follow-up, and then after that, then you can set up for if you're eligible to do implants or to do braces or what have you.
Is there anything that where people can actually take care of their gums without getting the disease? What would you suggest?
Flossing is a big deal. Many people in the community do not floss. They use a toothpick, and actually, toothpick can actually damage your gum. So you want to floss every time after you eat. You want to rinse with alcohol-free mouthwash. So a lot of people rinse with mouthwash with alcohol in it, right? And that actually does more damage. That increases the bacteria and germs to grow, when there's alcohol.
Okay.
So you want to use alcohol-free mouthwash, and then of course you got to do the brushing after every meal.
Okay. Wow. Thank you. I never really understood. I know general dentistry versus a cosmetic. Do you also do general dentistry, or people could just come to you just for cosmetic?
Yeah, so general dentists can do all the different kind of surgeries. General dentists place implants, they do gum surgeries, they do cosmetic, they do everything if they are trained.
Okay.
So as opposed to an orthodontist who only can do braces, they cannot do anything else.
Okay, thank you. One of the things that I noticed about your business is that you guys have a lot of success, especially in terms of reviews on Google reviews. I mean, I'm like, you guys are like way up there, like 250 something Google reviews. I mean, that is freaking amazing. How did you guys get all that?
just by random chance. Some people, they feel obligated. They want to write a review. Some people want to write a positive review. Some people write a negative review. Whatever they feel like writing, and that's what they feel, they write it. We can't really control that kind of stuff. All we can do is the true litmus test is you got to do the right thing at all times. So we try to do our very best. We're not perfect. We're like any other humans. We make mistakes too, but we try our very best and try to be genuine, sincere, and honest about everything that we do. If you need the procedure, we will take the X-ray, explain to you what you need to be done and all the options, and you decide.
Okay. Currently, how do you advertise your services?
We advertise by word of mouth.
Okay.
The local newspaper, the local TV, the local radio, online.
Okay. I know that the pandemic has really taken a lot of toll on the businesses. How has it affected your business?
Oh yeah, definitely for sure. The cost of all the PPPs, the PPEs, it's been everything's all jacked up in price. So for example, the gloves used to be 10 times cheaper. Now it's 10 times more. So and then also a lot of materials get back to order. So throughout this whole year, the COVID-19 has been very difficult for us because sometimes, it takes us a long time to get the supplies that we need. And then also at the same time, people are scared too, So, but, people that have a toothache or they're in pain, they have to go see a doctor, So it's a fine line. It's not easy. We try our very best, when the days that we are open. It's just difficult for not only us, everybody.
Did you guys have to fire anybody, or did you guys kept everyone on?
Yeah, we try to keep everybody on, but we don't open 7 days a week anymore. So, our hours have cut down drastically, down to like 4 days.
Oh, wow.
Or sometimes 3 days. So it's not easy because, patients are scared, staffs are scared, everybody's scared. And that's just the normal reaction because, COVID-19. The last count I saw this morning is like 465,000 people dead in this country. So, wow. It's just been a terrible situation for everybody.
What when a patient comes in to see you, how is the procedure now? Before there used to be packed of people lined up in the waiting room. How
no, we do it by appointment. We only do it by appointment. So
okay.
We also have to buy like these metaphor machines and all these other more these social distancing barriers, these plastic shields. Okay. We also have to use these machines to suck away the germs, and we have to make sure that the office is completely clean at all times. We have to disinfect everything all the time, nonstop. And we have to keep people, separated by at least 6 feet, So it's limited, appointments, the appointment spaces are separated, So yeah, so we see a lot less patients.
How much has that been reduced?
At least by half, I would say.
Half? Oh my God.
Yeah, it's significant.
Okay.
And the overhead for dental is very high, so it's very hard to manage.
I'm near the end of my questioning. Do you have anything that you want to say to people looking at this video?
Just everyone needs to stay safe and, just follow the guidelines. And then the silver lining in all this is that, the vaccines are out. So hopefully everybody get vaccinated, and, that would help a long way, to... if we follow all the measures, at the end of the day, we all will get through this. It's been a challenge for us, like all businesses out there. Mm-hmm. So we are trying to survive. It's been not easy, but, we still try to do the best possible dental services for the patients that need it. When they come in for, a toothache, the mom brings the kid in, or, the elderly that needs to get the gum surgery, we try our very best to help them with all the different guidelines, the social distancing and, limited patients that we see. We try our very best,
What's, what is the youngest that you see patients?
We see 2 and up.
Huh?
We see patients 2 years and older.
2 years and older?
Yeah.
Okay. Wow. Okay.
Yeah, that's for general dentists.
Okay. I guess that's better. I don't have any more questions. I really... this is where the information is, okay?